Good afternoon, ladies and gentlemen. Thank you for joining me for another episode of Campbell Talk. And today we have with us Maricurz, and she is from, or she works with, the Florida Department of Health here in Palm Beach County. And as you know, it is April, and FYI, my birthday is on Wednesday, but we're here all of April talking about youth and young adults and HIV. So we would like to hear from you if you're watching this live. Go ahead, drop your comments in the comment section. We'll do our best in your questions, and we'll do our best to get it answered on air. And if you're watching this after we've gone off the air, still comment in the comment section. If you would like to know where to get HIV testing or STD screening or treatment or get connected to other resources, please reach out to us. We would love to hear from you. Sometimes we can't do it by ourselves, sometimes we need a little help to just get us over the hump. So if you are in need of help and you are in need of resources, please reach out and we'll do our best to help you. So this way we can help our community to be stronger because together we can achieve more. So I'll be right back with Maricurz. Hey, Maricruz, welcome.
Hello.
How are you?
I'm wonderful. Thank you so much for having me on here. It's such a pleasure. I know all the greats have been on here, so it's finally my turn.
Right? Absolutely. Well, we're really excited to have you, and we're just going to give you the spotlight right now for you to tell us about yourself. What do you do? What do you like doing for fun?
All right. Well, so like you said, my name is Maricurz. My pronouns are she and her. I am currently the EHE coordinator here in Palm Beach County for the Florida Department of Health. So that's ending the HIV epidemic coordinator. Um, I came into this role about a year and a half ago now, but I have kind of always had a huge passion for sexual health, just public health in general. Growing up, I wanted to kind of go into the medical side of things, but more recently, and with the pandemic and everything, I kind of switched over to having a much larger interest in community health and sexual health. Education and all of that great stuff. So I was, kind of fortunate enough to be able to hop into this role, which has been amazing. I have gotten to meet so many amazing people like Richardo. So that has been, kind of a huge learning opportunity, networking opportunity, and I've gotten to know the community a little bit more, and it's been amazing. But yeah, so that's kind of work me. So fun me is kind of I love the beach. I grew up in Florida. I'm originally from Ecuador, but I moved here when I was around 5. So Florida and the beach and being outside has been my entire life at this point. So that's pretty much where you'll catch me on the weekends is paddleboarding, out on the water or the pool. Just anything like that. Um, I have recently moved a little bit closer to the beach, so it's super nice. I can kind of now, take a little circuit car over to the beach or even walk if I'm feeling adventurous. So that's kind of really fun. Um, so yeah, this summer I look forward to doing that. Um, Traveling is another one of my kind of huge passions. I am checking off a huge bucket list item this summer, and I'm going to the Galapagos Islands. So, I mean, like I said, I'm from Ecuador, but I've never actually been to the Galapagos, so that's kind of uh, a bucket list that I should have already been able to do, but I'm excited to finally get to do that now. And and this job has been a huge part of me being able to do that. So I'm super grateful for the community that I've come into, everything that I've learned, and just where it'll take me at this point.
Awesome. Well, thank you for being here. And that's pretty exciting. I've never been there. So it is on my travel list,
Absolutely.
my wish list. It continues to stay there.
Right.
Hopefully not for too long, because I do want to like cover all of the countries in Central and South America. North America already got that covered, and I'm working my way through all the states. I think I've been to at least half of them already, so that's
That's
pretty
awesome.
exciting. Um, so that's exciting.
Yeah,
Uh,
I haven't even gotten that far. So you're already on top of it, you know.
yeah, I know. Like last was it Christmas into New Year's? Uh, my family, we just kind of got in the car and drove from here to Quebec and stopped along the way. We stopped in Connecticut, we stopped in New York City, and a couple other places along the route. And I mean, it was just amazing. It was just
Yeah.
fun.
That's
Uh,
honestly the best way to see the United States. Like, I wish I could just hop in a van, live in a van for a year, and see the whole country kind of thing. Because it's just like we have the most amazing parks and like all these things to be able to do that. That's definitely a bucket list item as well.
yeah, I don't know how long I would be able to do that.
Living in a tiny space.
Like an RV, and like I can't even say aloud because I know my husband wanted to do that so bad. He's like, we should rent an RV and like go, and I'm like,
Will you guys
yeah.
survive that though in a tiny space?
I mean, we were in the car for 24 hours driving to Quebec, so that was pretty cool.
Right.
Um, and we've done like road trips to Texas and things like that. I mean, we're pretty busy and we're pretty on the go. Like we're not originally from Florida, so we don't. We're always about exploring and finding new things. But yeah,
That's awesome.
so we're gonna jump in and we're gonna start with our first question.
All right.
Um, you know, what do you think it will take for us to end the HIV epidemic? Or can we end the HIV epidemic, particularly among youth and young people?
Yeah. So I think it's absolutely doable. Um, it, I think there's two kind of coinciding things happening. Is that I think the current generation and the generations coming up are being able to talk about sex more openly. There has been kind of this sex positive movement, and all these things that are happening that are great. However, we do have to marry that a little bit with the other side, that is HIV stigma, and honestly, just the idea that like HIV is something from the 80s prior to when we were even born. We didn't go through it, so it clearly doesn't exist anymore. It's not something we have to worry about. So, getting that education piece into it is so incredibly important, because, like I said, the conversation's already there. Like that, I think that barrier has kind of already been flowing and things have improved on that end. Um, but now we have to bring HIV back into the conversation and really educate that like it is not a thing of the past. It
Mhm.
is very much here. And if we don't do that, then we won't be able to end this epidemic. But if we get it out there, I think the youth will be who ends this epidemic. Um, and we just have to really push for it.
Yeah, we got to keep keeping that conversation at the
Exactly.
forefront because we can't let it go. We have a question in the chat already. Come on, folks. Miss Sandra Anderson said,
Miss Sandy.
"What are the most significant barriers you are noticing that impacts EHE goals?" And for those of you who don't know, EHE is ending the HIV epidemic. So,
Exactly. Yeah.
you know,
So definitely the biggest barrier, like I said, is the stigma piece of it. People are scared of HIV. They're scared of what that means. They just rather not talk about it. Multiple times, especially amongst my peers, I've heard them say, "Oh, that exists. That's something that we still have to worry about. I thought we cured that." And unfortunately, we haven't. So that piece of it, or people still thinking that it's something gross, and it just should rather be something that's brushed under the rug kind of thing. I think that that'll be our biggest barrier with youth, and then also with really any generation. It's still such a huge thing. When it was happening in the 80s, it was only a gay disease and all these things, and that's still very much prevalent within the older populations. So stigma overall is our biggest barrier.
Okay. What can individuals or even families do? Well, we that's kind of like a two-part question. So we can probably start with like individuals. What can individuals do to kind of like address HIV, either like for themselves or their families, or what can families do? Or you can choose whichever one you want to tackle. Is like what
Um,
can individuals or families do to begin to have that conversation, or to begin to kind of like discuss or talk about or address HIV within their families?
Yeah, absolutely. I think you're right. It is a two-part question, because, like I said, many of Gen Z and millennials are having the sex positive conversations already. However, it might not be within their families. It's with their peers, at school, online. So starting that conversation already is good, and bringing HIV into those conversations, I think, is very positive as well. So if they can kind of start that within their peers and everything, that's already a great step. I completely understand that having that conversation within a family setting is much more difficult. But I think just kind of starting small, having um, just small conversations, based on facts. And if you have questions, asking, a family member or someone that you trust, just being honest that you just want the straight up facts about a topic. It doesn't have to mean that you are sexually active. It doesn't have to mean that you have HIV. It doesn't have to kind of get there ever. It simply just needs to start somewhere. That way you can get some facts out there. You can normalize the conversation and kind of go from there.
Okay. So sometimes people may feel powerless to about what they can and cannot do. So what would be some of like the simple everyday things that you think youth and young adults can do to prevent themselves from having from acquiring HIV? I know we talked about having those conversations, um, but what else can they do?
I mean, the absolute biggest thing that they can do, and the biggest tool we have available to us right now, is PrEP. So having that conversation with your healthcare provider, and looking at the options that are available to you, whether that may be condoms, or getting yourself on something like PrEP, that would be, the absolute most valuable, most protective thing that is available. Um, PrEP is extremely it's extremely valuable, but it's also very easy to get if you know where to look. It can be affordable if you know where to look. So even just starting that conversation up within your healthcare provider setting, um, that can kind of get you going somewhere. And then absolutely with your sexual partners or anyone that you're thinking of becoming sexually active with, just having that open and candid conversation, which absolutely can be awkward. Like, I am
Mhm.
not that far removed from those awkward high school years, and I can clearly remember it. I can clearly remember even cringing about kissing someone or having that weird conversation. So I absolutely know that that's something very awkward. Um, but just being honest and candid, and knowing that you have to do this because your health is important. and whether it might be a little awkward or you might not end up, compatible with that person because they didn't want to have that conversation. But you have to see that you matter most, and your health matters most. So it has to happen.
Absolutely. Comment in the comment section. Doc Anderson said, "Excellent conversation, Richardo. We need to keep this conversation going to our communities." Absolutely, it's going to take everyone to ensure that these conversations continue to happen and that these conversations are happening. And you have to find and access the right information. So, where can people, besides Campbell Health Solutions, y'all, where can people find um, credible resources that they can use when talking to their, it's particularly the parents, that they can use when talking to their young adults or their youth about HIV and STDs?
I mean, I'm always gonna kind of my science self is always gonna quote CDC. That's where you're gonna get kind of the most raw information, but that might be confusing at times. CDC is like an endless stream of information. You can get lost on that website very easily. So breaking it down to going on like the Florida Health website, or even kind of shameless plug, we do have our social media accounts, Test Palm Beach, and those are really great. We have kind of smaller nuggets of information to kind of get you started with that conversation. Um, there is even a lot of like HIV.gov hosted websites and things that are a lot more people friendly, um, and youth friendly. Because again, that information can sometimes be like terrifying and you're using a million different words and a million different acronyms within the HIV community. But breaking it down and using credible social media accounts like HIV.gov, and CDC and things like that is a really, really great way to get that started. As well as, thank you for putting that up, our Test Palm Beach Instagram and Facebook. If you ever reach out and just have a question, it's going to be myself or my coworker answering those questions. We can always get you that information, point you in the right direction. So we're always more than happy to do that. It's not a robot talking back to you or anything. So we're always more than happy to do that.
Absolutely. It's important to get the right information and to get accurate information and to know. And in addition to that, Campbell Health Solutions, we here have a program. We have education programs that we put together for individuals and families that we can have one-on-one or family, family unit discussions around HIV and STDs and around sort of like sexuality and things like that, just so this way parents can equip themselves with the right information when talking to their young adults. And I know on last week's show, we were talking about tips that parents can do to kind of like engage their children or or their young adults around um, HIV education and sexual health and all this other stuff. So, if you want to find out some additional tips that parents can utilize when engaging their teens or their preteens about um, sexual health education, about HIV and STDs, we have tons of resources that was on that last show last week with Dr. Kinlaw Williams. So, you should definitely check that out. And if you have any questions about HIV, Hep C, HIV services, anything like that. I'm going to put our number up here. Um, so yes, you can get a free HIV test. But in addition to that, you can find out about our educational programs that can help you to become more educated about having these conversations. So this way you're ready to deal with it. And also remember, you have to kind of like prepare yourself for what your teens and your young adults are going to say, right? Because sometimes they may be doing things that you don't know, or maybe engaging in activities that you don't know, or maybe feel or think a certain kind of way. So the whole idea is not to just kind of like have a total meltdown, right? It's about really just absorbing that information and saying, okay, all right, let me just wrap my head around this and let's just jump in and get down to it and not kind of like point the finger or make the because
Right.
that's how we continue to like foster,
Exactly. Yeah.
stigma
And that
and
that fear,
yeah,
you definitely don't want to be reactive. I think one of the most valuable things that I have ever learned for this field and really for anything is, first of all, when you're talking to someone, whether that be your own child or anyone young, really, they're going to tell you in their own way what they need from you. So you might be wanting to talk about HIV and condoms and PrEP and all these things, but that might be too much information for them in that very moment. So they'll kind of guide the conversation for you almost, and you have to kind of be attentive to that. And then, like you said, don't be reactive. When something like that comes up and they do mention condoms or they do mention HIV or sex or anything, it can be kind of like jarring. You're like, oh my God, you're clearly not this 8-year-old kid anymore. And you have to kind of readjust, but not being reactive and just seeing really what they are kind of asking of you is really, really important. And you have to just not be afraid in that moment, which can
yeah,
be terrifying.
absolutely. And I think sometimes when we hear things, maybe just taking a step back and just just let it sink in a little bit before having those conversations will help you to gain control over your emotions. So this way you're not like um, providing information in a more scolding kind of way,
Right,
because the whole purpose is that you want to facilitate safe conversation and ensure that your youth or young adult feels safe to have these conversations with you, and to be able to trust that they can come to you and get like solid advice and not like go to their friends who may just be like googling stuff off Wikipedia. you
right.
know you remember when blue waffle was a thing and
Unfortunately, yes.
everybody was swearing up and down.
I remember it all too well because that was my middle school experience. So I think I have that trauma that I
Yeah.
can
And I was like,
clearly
they're
recall.
like, there is no such thing. And they're like, yes, it's a new STD. And then it was like a new disease. And it was like all over. And I was like, no, it's not. And it was, oh my God. It just spread like wildfire. And
Yeah.
everybody was talking about
Yeah,
it.
no, really.
And
And
but
honestly,
the,
thank God at that point we didn't have the Google in the palm of our hands just yet.
right,
But now they do. Now that's out there, which can be great if you're going to credible websites and credible things.
right.
Um, but yeah, that blue waffle situation was just something else.
Yeah, especially if you're looking for objective information, you want to stay away from like some of the sponsored stuff. You also want to stay away from, like a lot of the Wikipedia stuff, because those are written by everyday people, and
Anyone.
anyone can edit a Wikipedia and add to it, and you know whatever. It's you don't have to have
Yeah,
tons of resources to do just about anything. And I'm
yeah,
not knocking it. It gives you like a quick answer to something, and
right.
or a quick overview, so you can kind of like get a sense of what something is. But it's not necessarily
Yeah.
factual.
Yeah. And like you said, even if it's something that'll give you that quick answer, a lot of times stuff like with health changes so quickly that
Hmm.
whatever's on there might have been true a month ago, but we actually have updated information and updated guidance and better ways to be safe
Right.
um, that aren't on there yet. So staying on those like credible the .gov websites, the .edu, all those are it's going to be your best bet for everything in life.
Yeah. uh, CDC, National Institute of Health, um, was it NMAC, National Minority AIDS Coalition, I think it's called. Uh,
Coalition, yeah, I think so.
NASDAD, National
NASDAQ is
Student
awesome.
Services.
NASDAQ is actually a really good source for parents and things like that because they do have more kind of boring information on there. It's not as kid friendly, but
Mm.
if you want to kind of gather that information, it's a great place. Um,
And if you
CDC
want,
and
yeah,
HIV.gov have like social media toolkits. So if you want like the more fun, the pictures, the little videos, ways to kind of explain things like that, I think that'll be a really good resource for that.
yeah, and they also have like HIV.gov, I believe, also have some YouTube videos that
Hmm.
you can kind of like watch and kind of like learn. Um, it's more, all the young folks these days are all about videos. So you can kind of like watch a video and then have a conversation about it.
Right.
So those are also very interactive as well. So these are just different resources we're putting out there to say, hey, this is how we end the epidemic, and education is a part of that.
Yeah.
Uh, we talk about condoms, we talk about getting tested, we talk about prep, but we have to keep the conversation at education as well. Because when you are informed about anything, you are able to deal with it, or you're able to kind of like navigate your way through it or around it if you know exactly what it is. But when
Right.
you're unsure, chances are you'll probably put yourself at risk.
Yeah.
And that's kind of like the whole point. We want to keep you from putting yourself at risk. We want to starve off HIV, so zero in new infections. And the people who are living with HIV, we want them to continue to live happy and healthy lives. And then we can sit back and say, remember when HIV was a thing?
Yeah, that's kind of my goal. I always being kind of the youngest in the room and everything. I'm always asked that question, like, oh, you have like such a long career ahead of you, and what do you want your legacy to be, and all these things. And I'm like, I don't want a legacy in HIV. I want it to be a thing of the past that I briefly helped out with and did my part and got right out of there. Like I don't want this to be another thing that takes over another generation and just keeps on going. So
Right.
got to get there, like you said, with the education and just talking about it and putting it out there and realizing that it very much exists um, in all generations. Um, I actually have a little data for you.
Okay.
Um, so
Yeah,
in
that was actually exciting because I was just about to say you can go on AIDS View and get data on there. You can also get it from what's your website called? Florida Charts.
Yes, Florida
Yeah.
Charts. And
So,
actually,
mhm.
as of today, Florida Charts now has an EHG component to it. So you can actually see what the EHG counties are doing. So that's kind of really exciting. I actually haven't even had time to explore it all yet because it did go live today. But Florida Charts is really, really amazing. And it can break it down by county, by cities, just Florida in general. So that's a really, really great place to get all the data.
Okay. All
Yeah.
right. You see, you have some data to share with us.
Yes. Okay. So our latest data that we have is from 2021. That's just how data works in this county and in this world. But so 31% of new diagnoses within males have been age 13 to 29. So that's 31% of new diagnoses.
That's a lot.
That is an insane amount. And then 18% are females within the age range 13 to 29. So those are just insane numbers to me. Um, and it's that generation that thinks that HIV is in the past.
Mm.
Um, it is very much not. It's here. It's prevalent. It's in your community. Those are numbers just for Palm Beach County. That's not a state number or anything like that. So 31% males, 18% females within that 13 to 29 range.
So
Um,
essentially, 49% roughly, right?
mhm.
About 49% of new HIV infections are between 13 and 29.
Yep.
That's crazy.
Yep. Yeah. So it's just it's an insane number, and it's for me like heartbreaking. Those are my peers. I'm within that 13 to 29 range. I'm shouting from the rooftops. You guys are shouting from the rooftops, and it's still happening. So anything we can do.
And I know like a couple years ago we've been talking about 13 to 24, 13 to 24 year olds because that was kind of like where the highest rates of HIV among young people were. And to now kind of like expanding that to 29, and the rates are still there. It's troubling.
Yeah, yeah,
It's troubling. These statistics are out of control. And, another way to look at it too, if we just kind of like look at everyone as a whole, um, the majority of the folks who are acquiring HIV are Black and Brown people, African Americans, Black folks who live in this country, as well as Hispanics and Latinos. So, we have to do something.
yeah, yeah. And I mean, year after year, Palm Beach County is, our priority populations continues to be that Black heterosexual group. Um, and the Hispanic Latino group is coming right up on that as well. And it's devastating. It's devastating for those communities. It's devastating for us as a whole. Um, we know that that is the problem. We know that that's where it's concentrated, and yet we continue to see it year after year. It's still, our priority population and where we need to do the most work.
Thank you. All right, so we're gonna take a quick break here because this is where we bring our educational moment in, and so I'm
Perfect.
gonna go on like a little rampage right now. So as many of you know, my name is Richardo Jackson. I host the show Campbell Talk, and we also are part of an organization called Campbell Health Solutions, and we now. Well, not now. We've always had it. So our official clinic is Jurado Health and Wellness, and that's where we'll begin housing our healthcare services. So all of that is happening in the background right now, and so we're pretty excited about that. Um, but let's talk about HIV. So HIV stands for Human Immunodeficiency Virus, and AIDS stands for Acquired Immunodeficiency Syndrome. A lot of times you might hear people say, "Oh, go get the AIDS test," or you know, go screen for AIDS. You can't screen for AIDS. You can't get an AIDS test because it doesn't exist. So you can only test for HIV. And if someone, and the reason why you want to test for HIV is because HIV can live in your body for up to 10 years without you knowing if you've never been tested. So you want to make sure that you get tested at least once a year. Um, as a rule of thumb, once a year, pick any time, your birthday, your anniversary, something. But once a year, you go get an HIV test. Outside of that, you also want to make sure that if you are having multiple partners, and it doesn't mean that you're friendly or all the other names that come with that. It just means that you might be a serial monogamous, right? Because when we say we have multiple partners, people think, oh, you're just running around being a hoe or something like that. No, you might be a serial monogamous, right? So you date someone for 6 weeks, 90 days, and it didn't work out. So you date somebody else for 90 days, but at the end of the year, you have like two or three partners. And some other people may choose to have multiple partners more than that. So every time you switch partners, you should go get an HIV test just for good measures, just to know that you are HIV negative, just to make sure that you continue to utilize the preventative options that are available to you, like condoms, like PrEP, um, abstinence is an option. Masturbation, self masturbation is also another option. So you can kind of like, avoid STDs and HIV. And if you do decide to have, if you do get an HIV test and your test comes back reactive for HIV, then you want to make sure that you get in care right away. So this way you can start to take care of your health. The sooner you get into care, the healthier and longer you can live. And so that's what you want to do. And you also hear us mention like prep, and sometimes you may say, what is prep? KS prep. um, and so prep stands for pre-exposure prophylaxis, and basically it's one pill every day that helps, well, that prevents HIV. It used to be like it helps to prevent HIV, but it actually works. So it helps to prevent HIV, and it is accessible. You can call us because we offer prep to the community and we offer that service here, and we do free HIV testing. So if you are having sex with someone or someone is having sex with you need to get an HIV test. So definitely give us a call. I'm going to throw this number back up on the screen again. So call us to find out if to get your schedule your HIV test, and it's free. It's free, 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 free. You don't have to pay for it. You shouldn't be paying for an HIV test. You should just go in and get one done for free. So if you would like free HIV testing, it's available here. It's available at the health departments. Well, you know, at the clinics in the health departments.
Absolutely.
Definitely on awareness days, you might want to go in there. And also, there are other community based organizations throughout Palm Beach County, around the state of Florida, and across the nation. And if you are just kind of like, look, I know I can just Google someplace close to me, but I rather just call someone and have them do it for me. Reach out to me and we'll talk it through and we'll figure something out. The number is on the screen. Give us a call. We want everyone to know their status. I think if everyone go out and get an HIV test in 2023, we all will be in a better place because we'll know our status, we'll know what we need to do to continuing to be negative, and we'll know what we need to do to continue to live healthier and longer with HIV. And we'll also know how to protect each other. So, if you want to learn about any of those things, or if you want to learn how to talk to your teens, or if you want to learn just for your own edification and just so you can have the answers that you need, reach out to us. If you, after the show, if you're watching this at some point later on during the week or whatever, and you have questions about EHE and you want to know what the health department got going on, maybe you want to get a job over at the health department, absolutely reach out to us and we'll make sure that we can get you information about how you can do that or where you can find more information and also what activities are happening. But also make sure you go onto the Test Palm Beach Instagram on for the folks who don't know, IG. Instagram, y'all, Instagram or FB, Facebook. Check it out and see. And they got lots of cool stuff on there. Lots of videos, lots of awareness days, lots of events happening. And maybe you're watching this on there at some point.
For
Because
sure.
they'll probably be over there before the end of the day. So absolutely, just check it out and see. And if you have questions or comments, always feel free to ask. You can inbox us or you can put it in the chat. However you feel like communicating, we're down for it. We just wanted you to know that information. Oh, and by the way, you cannot get HIV from tears, from hugging, from kissing, from using the same utensils, plates, forks, spoons, using the same shower. So, to all my Caribbean people who are like bleaching down the shower, you're not going to get HIV that way. So,
And to my Hispanic people, I know
yes,
you're out there too.
let's kind of just really get the facts so we can move our people forward and support our loved ones who are living with HIV. It is very stigmatizing when things like that happen. And folks say, "Oh, you can't eat with these dishes. You got to eat over there." Or, "Oh, you can't. You need your own sheets and your own pillow and all this other." I mean, definitely, you might need your own pillow. Everybody needs their own pillow.
More for comfort.
Right, everybody needs their own pillow. But at the end of the day, like, don't just say, "Oh, you can only use this pillow because you got something going on," or whatever the case is. It's very stigmatizing. Let's just give more love. Let's put more love. Um, love is in need of love. There's a song, love is in need of love today. So let's just do that. Let's just love on people And if you come across someone who could benefit from some of the resources or information we share today, absolutely connect them, because we're in this together. We're in this together, and we need everyone to work together in order to achieve this. So, how we start is by everyone going and getting an HIV test, everyone knowing what their status is, knowing, learning about what they can do to, either stay healthier longer if you're living with HIV, or stay healthier longer if you're living with a negative HIV status. And, if you are a service coordinate couple, learning how to protect yourself and learning what resources are available. So, I know we say a lot of things, and every week we come with, right in the middle of the show, we pause because we want you to understand how HIV is transmitted. It's transmitted through blood, breast milk, and vaginal secretion, anal secretion, as well as, what did I say? Unprotected sexual contact. Use condoms. We have tons of condoms here. And if you would like to receive condoms by mail, go to our website at campbellhealth.org, right? And you can request condoms by mail, and we will get those condoms out to you. So, thank you.
That's awesome.
Thank you.
You hit it all. You hit all the points.
Right? But how do we continue to motivate people to know their status? I know, like, some people do, like, oh, we're going to give out gift cards, we're going to do this, we're going to do that. But there are other things. I know, like, the health department, you guys give, like, little knickknacks and flippy things.
Yeah, we got all the fidget toys. We are ADHD central over here if you need any fidget toys. Um, but I think the most kind of, especially for the young population, is kind of just being like, hey, you want to come with me? I'm going to go do this test. Um, and on, like, I've gotten friends to do that. Even when COVID was prevalent, I would do that with COVID as well. It'd be like, hey, I'm getting tested. It's free. You want to come by? It'll take 15 minutes. Um, so kind of getting involved like that, just getting your friends in on it, normalizing it and talking about it. That way, it's not a weird thing. It's not a scary thing. Maybe it turns into a monthly thing you guys do, just as a group, and just make it fun. Like, let's go get an HIV test. We'll go get ice cream. We'll go watch a movie. Um, it just kind of becomes a normal thing.
Right.
Um, and I think that's really the only way, especially for that, the young population. It's sometimes really scary, or weird to talk about health things with your friends, and that's like an adult thing that you're complaining about your backache and all these things. But if you bring it into it being such a normal thing with your friends, it's super doable, and it can become something routine.
Absolutely. Host a testing party and invite us to come and offer you resources and do HIV testing on site. So you won't have to leave. Everybody will be right there. All we need is one little private room.
There you go.
So,
That's awesome. That actually sounds like fun.
right. Let us use the coat closet.
Right.
something,
We'll
something.
change what 7 minutes in heaven means.
Right, exactly. And it'll be fun. Everyone will know their status, and it'll all work out, and we'll be on our way towards ending the HIV epidemic. What role do you think social media has played um, in HIV prevention, either towards ending the HIV epidemic or towards just making sure that everyone is aware of their HIV status?
I think social media is so incredibly valuable. I mean, first of all, it's our life now. Like, on any level, it's our life. So, incorporating HIV into that and having those candid conversations, and just all these TikTokers that are super candid about their status, they educate. I have learned more on TikTok than I have my 20 years of schooling, I think, at this point. So I think continuing to use that and realizing that there's so much value in that. I mean, I've heard from so many of my friends now that TikTok is basically their Google. So they'll go and they'll ask their question or put their thing into TikTok now. I think it's just like an amazing platform. But also Instagram and Facebook and all the traditional social medias. I think it's such an easy way to capture your attention for the 30 seconds that we know we have that attention for at this point. Get like a little snippet of information, and if you do have more questions, there's a great way to either comment and ask that question right then and there, or at least you have a starting point to go and Google it. Um, I think social media is going to be a huge part of ending the HIV epidemic, and continuing those conversations and starting those conversations. So I think we have to kind of use it as much as we possibly can at this point.
Absolutely. Social media is here to stay.
Yeah, it's not going anywhere. I mean, TikTok might be. I don't know what that conversation is at right now, but
Right.
but social
Yeah.
media is it's the way of life at this point.
Yeah, I think it's something to be out, and and don't get me wrong, you can get bad information on there, you can get accurate information on there. Again, continue to verify your source. Don't just take one thing and run with it, people. Don't just take one thing and run with it. And if you're watching this and you're a TikToker and you want to volunteer some time or donate some time to do some prevention messages, or kind of like help spread the word, and you just kind of like need some props and things and want to kind of like get some sound, what do you call it, content information, you can reach out to us.
Yeah, oh, absolutely. Like, I'm no social media connoisseur, but I've kind of had to throw myself into that role, and it's amazing. Like, what these social media creators do is truly like astounding. I know I'm not the one to do it. There's no way. I already know that that's not my calling, and that's okay. But yeah, like you said, if there's anyone out there that does want to get that message out there, wants to learn more, need some solid information, come to us. We will help you right out.
Absolutely. And your voice matters. And if you are a youth or a young person watching this and you are sexually active and have not been tested, please go get tested. Please make sure that you go get tested, and understand that you might have also started to be sexually active, but it comes with a lot of emotional, physical, financial stressors and consequences and things. And so, you know definitely, if you want to reconsider your options, you can decide at any moment that you just want to be abstinent,
Yeah.
and it's fine. And if that's not your path and you continue wanting to engage in sexual activities, make sure that you get tested and make sure that you use condoms. We're not here to tell you what you should or you shouldn't be doing. We're only here to help you to make healthier choices for yourself, to make sure that you don't, acquire any diseases that you didn't have to acquire. That's kind of like part of why we're here.
Yeah.
And, you know, so continue to have those conversations. Continue to, please turn to your parents. I know sometimes it might be really, really hard to have conversations with your parents, but definitely turn to your parents and try to have some of those conversations, or someone that you trust, an adult that you trust and that you feel safe and comfortable talking to, because more than likely they will have uh, better information or accurate information that they can share. And then you can talk through some of your fears and talk through some of the things that are happening. It's important that we have dialogue and conversation around these things, because we're not in a bubble. I can guarantee you that sometimes the same emotions and feelings that you're feeling, there's another teen across town, across the country, across around the world is going through or feeling those very same feelings.
Right. Or even
So
right next to you.
exactly.
Yeah.
And that's something you realize that when you get into your 20s and when you become an adult, you're gonna be like, oh, this is
Right.
what all these adults are going through. I want to go back to be a kid. I want to go back to be a teenager.
Right. No,
But
and you also realize like, oh, you also had that awkward experience in middle school. Like I thought I was the only one
mhm,
because we were never having those conversations. So if you have that conversation, you realize that like everyone is up to some weird, awkward situations. You're all doing the same things. You're all going through those same emotions. And if you have a buddy in that, it's always, helpful. It feels less scary to do all the scary things that you do in middle school and high school and college. Um, so it's like a huge, if you just open up and talk about it, you realize that like all humans were extremely different and extremely the same. So you're going through that together, even if you don't realize it.
absolutely. And have a pizza party and invite us to come do HIV testing and sexual health education.
There you go.
Got you.
That'll be real fun. Oh my gosh.
And you can get condoms from the health department, and you can get condoms for us for free, for free, for free, for free. You just walk in. You can, most places have them on their counters. As soon as you walk in, you can grab them for free.
Mhm.
Um, and not at the grocery store, y'all. That's stealing. But you
It doesn't
can
have to
go,
get there.
you can go to a community-based organization, and they have them there for free, and you can grab condoms, and also you can learn how to use them. They're usually trained staff available to walk you through the steps and how to correctly put on and remove a male and female condom, and also how to make sure that your condom stays on, especially while you're having sexual intercourse, and what to do if the condom breaks or if the condom slips off during sexual intercourse, what options are available, what you can do. And of course, we can let you know all of that information. So if you find yourself needing that information, please, 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 let me throw this number up again. I
Yeah,
can't say it enough. Give us a call.
do it. And again, shameless plug, reach out to us on social media. We actually, within hopefully the next week or two, we will have a little reel, Instagram reel up for instructing you how to put on a male and female condom. We'll go through all the steps, all the checks that you should do prior to using that condom and making sure that it's safe and not expired and all those good things. So we'll have that up coming up soon. And again, if you have questions, always reach out. If you need condoms and don't know where to find them, reach out either to our social media, give Campbell Health a call. There are just so many resources out there that you never have to be stressed out about it or worry about it or end up stealing from the store. There's just, you can find it anywhere. So um, just reach out.
Yeah, absolutely. And again, if you have questions, comments, feedback, go on or you can go on the website, check it out. You can give us a call. If you're watching this after, because we're about to wrap up, and it's about 7:54, so we're about to wrap up right now. And if you're watching this, today is April 24. Oh, first of all, happy birthday! Shout out to my brother Jeffrey,
Oh,
and I
happy
know,
birthday.
right? And
Happy early birthday to you.
and happy early birthday to me. And happy birthday shout out to my other brother, Junior. I don't know.
Oh my goodness.
My mom had three boys. We're all the same. We're all a day apart,
Oh my God.
and
Oh,
we're
bless
not
her.
born like back to back or anything like that. It's just
I think we should be congratulating her more than anything.
right. I was like, how did you plan this? Like, wow, what month is a really good month for you? Okay.
Right.
So yeah, and we're like literally a day apart from each other. So it's great. The 22nd, 24th, and 26th. Just kind of
Craziness.
yeah. So I was just like, wow. I don't know. I don't know what kind of magical operations
All
happen, but
right.
that's what it is. So kudos. Happy birthday to my brothers. I love you and care about you and wish you all the best. And Maricurz, thank you, thank you, thank you, thank you so much for being on the show.
Absolutely. Thank you for having me. Like I said, there's been so many greats on here that I was like, when's my turn? When am I coming?
And now you have joined the panel of legends who are.
Right.
Oh my gosh.
But
We
anytime that I
have to get
can, like,
Raba here one day.
yeah, no, absolutely. I'm more than happy to do it. I'm more than happy, especially talking to that young population. Um, that is, I am that young population. I'm still within that 13 to 29 range. And I want to, like I said, yell it from the rooftops that like you do not have to go through this alone. There's so many resources and tools out there to get us to the end of this epidemic.
Absolutely. Please, please, please. I say it again. Please, please, please. Reach out if you need help, if you need resources, if you need to talk, if you want to learn some more about how you can protect yourself, or if you want to learn about resources that are accessible to you. I know we're based here in West Palm Beach. However, I know folks are watching this from across the state of Florida and in other states. We can help you also to connect with someplace closest to you where you can access free condoms, free HIV testing, education, and all those other things. So if you need any of those resources, please do not hesitate to reach out. We thank you, thank you, thank you for watching. And absolutely, we're glad that Maricurz had finally
I finally
ascended
made
to
it.
she's ascended to the Legends panel.
Good.
So thank you so much, and we really appreciate you.
Thank you, Ricardo. It's been amazing. And you can call me back anytime.
I'll believe it. Believe I will.
Goodness.
Good night, guys.
Good night. Thank you so much.